and welcome. I'm Dawn Williams. I'm the Vice President of North Point Recovery in Loveland, Colorado. Our mission is saving lives and restoring relationships. Here at North Point, we help our clients move through their recovery journey. And with that, we have multiple team members that aid in that journey. We have nurses, recovery techs, and admissions coordinators. And today, we'd like you to meet some of them and have a day in the life at North Point Recovery.
My name is Rachel Aquino.
Hi, my name is Terrell Keith.
My name is Zach Zavanek.
I'm a charge nurse here at North Point Recovery.
I'm an admissions representative over at North Point Recovery.
I'm a case manager at North Point Recovery.
Being a charge nurse, you're in charge of the entire building as well as all the patients. Typical day is I come to work, I assign all the nurses their assignment, I'll get report on all the patients, check any new orders.
I coordinate people getting in here. I take calls, I do medical screening over the phone to assess whether we can take adequate care of folks considering their situation, and then they come on in and we intake them.
A big role for our case management team is meeting with our patients, touching base with them when they first get here to establish their goal for when they get out of here. We will touch base on if they have a therapist or a primary care provider or a psychiatrist. If they don't, then it's our job to help them find that, so when they do get out of here, their aftercare is all set up. We also help with dental and vision and intensive outpatient to make sure that they are very well wrapped in services upon discharge.
So here we treat mental health as well as their detox. Also here, what's rewarding as a nurse is we do teach groups and do a lot of education, where sometimes nursing in the hospital, we don't have time for that. So it's a lot more time to teach our patients.
Our typical day here at North Point, they all look different. It just depends on our caseload, how many people are here, and their needs. It is all mainly face-to-face. We will track them down or have a tech come bring them to our office and ask about their needs and what they're looking for, and just to make sure that we're on the same level, just like during their program here for the 25 or 28 days.
So working here is much like working in a hospital. We still have the same shifts. We do have swing shifts, we have night shifts, and you still are utilizing the nursing process here. You're still taking care of patients just like you're on the hospital, just on a different role. And you're still planning their outcomes, their discharges for a successful outcome.
I'm here 40 hours, so I do 3 12s and then I pop in for my last 4 hours.
We do have 8-hour shifts, we have 12-hour shifts, just like in the hospital. So the hours are very similar. And they're very flexible with staffing and scheduling as well.
Really, I work 3.5 days out of the week, so the rest are allotted. Usually one for errands, the other just spending time with the people I love. It opens up my schedule a lot, actually.
The other case manager and I have about 20 plus people on a weekly basis to work with, and some have higher needs and some do not.
My favorite part is being with the patients. My history is critical care, so it's kind of treat them and street them. So this is very different for me, and I'm enjoying to spend a lot more time with the patients. This is definitely my work family. We've all gotten very close. We work very close together, and the patients have become part of our family too. We do interact with them when they leave. They do see our outpatient, so it's great to see them outside as well.
So I wanted to be at a place where the patients were inside, where I could watch their journey and watch their growth and watch them grow, and I become ready to step into the next phase of their life with more confidence.
The most rewarding is easily when I see someone come in, right, in the state that they're in, usually. Sometimes at the worst point of their lives. And then, a week or two later, I see them walking around the halls, and sometimes I don't recognize them. Like, they say hi, and I'm like, what's your name? Because they look so much better, and I can see the light come on. So seeing that process and knowing I was a part of that is a beautiful thing.
The biggest rewards is seeing them succeed, seeing them stay here for 28 days, seeing them detox, and watching them leave and go on with their life being sober.
If someone comes in and has these high needs and have their barriers, if we can find a way through them and get them, like housing, get their resources and get their aftercare set up, and they have a plan and stick to it, it's extremely rewarding.
As for me personally, what got me into admissions is wanting to be in the solution. It's not just like accepting someone or not accepting someone. I get to really kind of manage a case temporarily, and I get to be in the solution. If
you're thinking of working in behavioral health, just jump into it and do it. It's so rewarding. Never thought I would love nursing again. Coming here has made me love nursing again.
Thank you all for joining us today. We really appreciate that you watched our video from North Point Recovery. We hope that you've learned a lot about what we do here and about what our team members do here. If you're interested in working in this field in order to make change and to help our community with their behavioral health and substance abuse issues, feel free to visit our website, northpointcolorado.com.